right, work me through this one here.
Okay. Which of the following interventions is most likely to alleviate his symptoms? 40-year-old man comes to clinic complaining of muscle cramps, irritability, insomnia. Past month, has been following strict ketogenic diet for weight loss. Noticed considerable improvement in his weight. Physical examination: dry, scaly skin, cracked corners of his mouth. Blood test shows mildly elevated liver enzymes, low serum concentration of coenzyme A. Okay. Um. Hmm. Coenzyme A. With the dry, scaly skin, cracked corners, I'm thinking, okay, maybe he's not in a ketogenic diet. Maybe he's not eating enough, like fruits or something like that. I don't. I'm thinking like vitamin C, oral multivitamin, supplementing with B5. I can't remember exactly what B5 does. Increasing protein intake, definitely not, because he's probably eating plenty of protein. Keto usually eats dairy and fat. I don't think mild, but what about the mild elevated liver enzymes and those? I wonder what the liver enzymes is about here. Okay, so he has mild LFTs, but he's not jaundiced or anything. Dry, scaly skin. Muscle cramps. Usually, like muscle cramps, you could think of magnesium, you could think of low iron. Um, that's what I'm thinking about. Insomnia, irritability. I don't know if a multivitamin is going to cover these issues, but then it's either multivitamin or like B5, but I can't remember what B5 does. Um,
Okay, what does your
let's
gut say
see.
here?
Yeah, I'm not sure. Maybe the oral multivitamin just because it's more broad spectrum, but I really don't. I'm not sure.
So it's actually your B5
Okay,
here. So
B5.
so
Okay,
you had it down to two. I think you have a great idea, right?
okay,
Multivitamin, right? It doesn't necessarily have B5 sometimes, right? And so
okay,
the B5, right, is going to kind of, this is angular colitis is something they always mention, right? Which is the
okay,
cracked corners of the mouth, right? Low serum coenzyme A. So you have a deficiency in pantoic acid, right? So essential for coenzyme A. So you got to kind of take some of this, especially since I think B5 probably comes from either grains, veggies, or things like that. Dairy
okay. Makes
products,
sense.
that's not going to really help here, right? Incorporating grains, right? Which would have B vitamins, but he's probably not going to want to do that because he's ketogenic.
Right. He's on ketogenic.
Um,
Okay.
Protein, right? Already taking protein doesn't make any sense, right? Multivitamins could potentially, so you had an idea of it, but the issue is also on top of that you don't know like how broad spectrum and does it have B5, right?
Right.
So
Okay.
so the best answer here would be to tackle it straight on,
Just
which is
B5.
B5. Okay,
Makes sense. I just couldn't remember what B5, the role
sure.
of B5 is.